I'd like to now invite Dr. Luc Bott to the podium. Dr. Bott is actually a resident at the University of Southern California, and he will shed some light on medical student interest in the IR residency. Dr. Bott?
All right, thank you for having me. So as Dr. Roshan said, I'm a PGY3, so still green, but I was tasked with talking about medical student interest in the new IR residency. I have no disclosures. You know, this is something that's come up quite a bit. As part of the RFS, we've been questioned quite a bit by medical students in our local and regional areas about what this means for them, and you know, if lots of concerns and anxiety about the new IR residency. But what we haven't really known is this going to cause more med students to enter IR? Is it going to turn people away from IR? So that's what I try to figure out for today. But to sort of contextualize this presentation, I just wanted to put forth a few data points. And over the past few years, there's been unequivocally an increase in interest amongst current residents in interventional radiology. And when you see the number of resident members of the Society of Interventional Radiology, we've almost doubled over the last couple of years. And when you look at attendance to the annual SIR meeting, we've also seen a dramatic increase in that. And if this year you include the number of residents, med students, and fellows, we've had over 670 trainees come through this program, which is pretty tremendous. Now, this is for residents only. For the first time, we're actually seeing a dramatic increase in the number of med students that are interested in interventional radiology. And if you look at just over the past few years, we've seen a close to 300% increase in the number of med student members in SIR. You know, this is in the setting, interestingly enough, of declining interest in diagnostic radiology. And we're seeing it an increase in the number of unfilled positions in DR. So the question is, you know, we have these med students for the first time. We're seeing an increased interest in IR with a decreasing interest in DR. So what does that mean? And what do these med students actually expect from their training? And what do they want? So what we did is, since I'm an old and gray PGY3, we just asked them. So we asked 65 med students from around the country. They're interested in IR but not committed to IR, and we tried to target sort of younger med students that were interested and showed this interest in interventional radiology. So most of the respondents are early in their medical career. And actually, we asked them to rank their specialties of choice. What are you guys interested in the most? In decreasing order, or in order of decreasing interest, we see that they're most interested in interventional radiology, but after that, they're actually interested in vascular surgery, cardiology, and other surgical subspecialties. So they're comparing interventional radiology to other surgical subspecialties, not diagnostic radiology. I think that's an important point. Additionally, we asked them what facets of interventional radiology really interest you, and surprisingly, most of these med students are really interested in treating vascular disease. It did edge out in this survey anyway, interventional oncology, though vascular disease and IO were far and ahead of the rest. We also asked them a pretty basic question. You know, if IR were not an option, would you pursue diagnostic radiology? If you look at it, over 50% of trainees, if IR weren't available, they would go into a different specialty. That's pretty important. So we're recruiting from this different pond of medical students. We also asked if, you know, how does this new IR residency program influence your decision to pursue interventional radiology? And nearly 75% said that they're either more likely to pursue IR or they'll definitely pursue IR because of this new residency program. We also asked them to talk about their perceptions of a program that didn't offer this residency. If a program didn't offer the IR residency, and by extension, the opportunity to become an interventional radiologist, how would that affect your ranking of that program? And we saw that nearly 90% of respondents said that that program would move down their rank list, or 30% said they wouldn't rank that program at all. We also asked them how important practicing interventional radiology in this clinical paradigm is, and we actually defined it with using the same words that Dr. Kaufman used in his presentation. So clinical, or resident clinics, having an admitting service, admitting privileges, things like that, being sort of true consultants. And again, 90% of respondents said that's critically important. That's how they wanted to practice. We also asked that if a program offered sort of clinical rotations integrated within your radiology residency, how would that influence your ranking of that program? And we see that 83% of respondents said that they would move that program up in their ranking. And then by extension, if a program were to offer longitudinal clinical training, how would that influence your ranking of that program? And again, 75% said if I can get longitudinal clinical training in your residency program, I'm going to move your program higher on my rank list. And then when we asked them, what are the three more, we gave them a whole list of possible answer choice, and we said, what are the following features that will influence your ranking the most of a diagnostic radiology residency program? And they said, if we can get greater than 10 months of IR training in residency, if we can get longitudinal clinical training and resident IR clinics, those three sort of were key features that they were looking for in residency programs that would cause them to rank that program higher. And then I think this is, the bottom line. On your way to becoming an interventional radiologist, would you rather pursue the IR residency program or the traditional pathway? And we define these terms for them. And overwhelmingly, we saw that 90% of respondents would rather become an IR through the IR residency rather than the traditional pathway. And I wouldn't be doing them a service if I didn't include some quotes directly from med students. And these are actually excerpts from SIR's Med Student Training Scholarship. Okay, so you may agree or disagree or think this is foolish, but this is what med students are saying, so that's why it's important, I think, to include. Okay. So it says, perceptions of current IR practice. Imagine having a root canal and being told to call your car mechanic if you experience any problems after the procedure. Clearly, this makes no sense. Similarly, does it make any sense for a patient to follow up with their PCP for their Mediport? The only thing the car mechanic or PCP can do is send you back to the person who initially performed the procedure. Why not just go back directly to the interventional radiologist? This is absolutely no reason to have a patient to jump through hoops to see the physician that took care of them. It's not fair to the patient, and it's bad care. And then I thought this was phenomenal on longitudinal patient care. To do it any other way would be a breach of trust that the patient entrusted upon the interventional radiologist. There have been many advances in IR over the past few years, but I believe the greatest advancement is establishment of IR as a clinical specialty. This is, I think, a third-year medical student that said that. So, take any questions, but there you go.
Yes, question?
Oh, yeah, so we wanted to target people that were already interested in IR because that's our target audience. So we have IR interest groups set up around the country. We have about 30 from coast to coast, so we just sent it out to all of them and then asked them. We pestered them until we got a fair number that responded. So.
Any other question for Dr. Bott? No, that was great, getting that sample of students and letting us realize that the ones who are going to affect the most, I mean, this is what they really want.